guys, it's me, Adam Deshawn, with another video. So this video is going to be discussing my worst shift thus far as a nurse. So let me take you back to last year. Those of you guys who remember, I was in El Paso, Texas for a contract. Very difficult time on this contract. You guys know I made a video about that back last year about how much I did not like working in El Paso, Texas. So this video is going to be referencing a very bad shift at that assignment. So the day started off, you guys know I was working day shift. So the day started off already kind of like odd because I had to be floated to another shift. To another unit. So I'm already kind of disoriented from the day. Like, I'm already disoriented. I'm floating to another unit and I really don't know this unit. And so I'm already kind of starting off a little disoriented. You know, those of you guys know who, if you have to float often, it's kind of like, where am I? Where is everybody? Where is everything? Where's the supplies? Where's the med room? Where's the pixie? So you're already kind of disoriented when you get to the unit. So of course, I start off my day. I have like 5 patients, and my patients are not very hard, but they're not very easy either. So it's a little bit of both. So immediately when I get on the unit, I get report from the nurses. I automatically see that 2 of my patients have discharge orders. And those of you guys who work in the hospital, you know that discharge orders means admissions are coming to you. So that's definitely nothing you want to see early in the shift. So I get on the unit, I already see that I got 2 patients that are discharging that day. So I'm just like, fuck. I just know what this means. So of course I go get into the rooms, and you know, like anytime the doctor tells the patient, like, hey, you're probably gonna be discharging tomorrow, you get to the room, the patient's sitting on the bed, like with their bag in their arm, like they ready to go. Like, you know, they don't understand that there's a process, that there is a systematic way of doing the discharge. Like, a lot of times the doctor haven't even put in the discharge orders yet. So I just got a lot of patients just sitting on the bed with their bag ready to go. So I'm trying to tell these people, like, hey, it's probably gonna be a minute. I don't even have any discharge orders yet. And the doctor probably is gonna wanna see you before you leave. Mind you, you guys know that I was in El Paso, Texas, which is a heavily Hispanic populated area. So a lot of patients speak Spanish. They don't speak English. And that was a huge barrier while I was in El Paso, because of course I don't know Spanish. And we did have tablets that we used as translators, but if you needed to run into a room to do something really quick, like just to get the tablet and to pull it up and get the translator online, takes a long time. So I learned a lot of Spanish when I was in El Paso, Texas, a lot of Spanish. So anyway, the day's trucking on. Of course, I get my 2 patients out of there by noon, but of course, 2 patients gone means 2 patients in. So no sooner that I start getting the discharge orders ready for my patients, of course, the charge nurse who is assigning patients on the unit is already calling my phone like, hey, you have a discharge order for this patient. You know, what time are they leaving? So I'm already kind of annoyed because I'm just like, I'm already overwhelmed. I haven't even passed meds or even seen all of my patients, and you're already calling me with potential admission. So I'm just like already over it. So get 1 patient out, of course. Hey, Adam, you're getting an admission to room so-and-so, so-and-so, so-and-so. I'm just thinking to myself like, oh gosh, I haven't even had time to catch my breath. And typically how my shifts go, I will kind of like pass meds to my patients, see my patients, and go sit down and like maybe have like a 15-minute break, drink my coffee. Wasn't even able to do that day. So I'm already annoyed, right? So admissions are coming. So of course, along with my 2 discharges, I get a 3rd discharge, and that patient's going home. So I'm like running like a chicken. It's like so much going on. And of course, and remember, I'm on a new unit, so I don't even know like how shit goes. I don't know where shit is. It's just, so I'm just running like a chicken. So, but typically that's a typical day, honestly. But the patient, the 3rd admission I got for the day is the patient that really fucked my shift up, bless his heart. And with no with no blame on him, this is what it is. So anyway, charge nurse calls like, hey Adam, you're getting a patient to room so-and-so. The ICU is on the line. So this patient was a transfer from the ICU. I was like, all right, cool. I tell the ICU nurse, can I give her a call back? Because I'm just like right in the middle of something, but I kind of just want to review his chart before I talk to her on the phone, because I like to go into report very prepared. So I get on the chart. I'm looking at his chart, and I'm thinking to myself, like, man, this patient does not seem like he needs to come to the MedSurg. I just don't think he's ready to come to a MedSurg unit, because he seemed to be still very unstable according to his labs that morning, and also according to his vital signs for that day. So I kind of mentioned this to the charge nurse. I was like, hey, this patient's coming to me. He's still a little unstable. I mean, I don't know if this is the correct fit. So the charge nurse pretends like they check into things, but I already kind of know in the back of my mind, like, this patient is coming to me, blah, blah, blah. But, you know, in retrospect, I also think about, like, this is when I should have really advocated for myself and my patient, because at that time, I knew that patient was unstable. But me not wanting to be problematic, me not wanting to be, me wanting to be a team player, I just went along with it when I knew deep down that this patient was not ready for the unit. Or my unit. So I get a report from the nurse. Patient doesn't seem as bad as the labs suggest. So I accept responsibility for that patient. I accept that. So, and this is another thing to you guys. When you get a report, you kind of accept the transfer of that patient. So be mindful of the type of patient that you are taking before you actually take them. So patient gets to the room. Of course, he is Spanish speaking and his daughter is Spanish speaking. So immediately when he gets to the floor, his blood pressure is trash. And of course, I look at his mark, meaning his blood pressure is like high as fuck, and vital signs are all crazy. And of course, he has no as needed medication for blood pressure. So I'm already on the phone calling the doctor for PRN blood pressure medicine, and he hadn't even been on the unit for 30 minutes yet. So first, that was the first thing, his blood pressure was very high. So after, of course, I get the blood pressure medicine order for him, it must have created an arrhythmia in his heart. So the telemetry room is calling me saying, hey, this patient is in a odd rhythm. We haven't seen this before on this patient. So of course, I'm calling the doctor back about this. Like, hey, his rhythm's funny. And so the doctor orders another medication for his rhythm. So as the shift progresses, this patient is starting to decline. Honestly, his vital signs are starting to decline. He doesn't look as good as he did when I first got him on the unit. So I'm calling the doctor, and I was like, hey, so this patient is not looking well. I don't know if you've seen him today, but can you come and see this patient, please? This is me talking to the doctor. Okay, I'll come see him. Hours go by, and I'm calling this doctor back and forth, and the doctor's still not coming to lay eyes on this patient. And I'm trying my best to paint a picture for the physician, but he is still not coming to see this patient. So at this point, I'm telling my charge nurse, I'm like, hey, this patient is not looking good. He's not at the point to where I need to call like a rapid response or anything. I'm trying to prevent that by constantly calling the doctor and constantly calling the charge nurse, but this patient is still declining, right? So as the day goes on, it's probably maybe 2 hours to the end of my shift. I'm sitting outside in the hallway documenting. And when the patient's daughter runs into the hallway urgently, she's like, come into the room, something's wrong. Run into the room. This patient is not responsive. He's not responding to verbal stimulation, meaning he's not responding to me saying his name. He's not even responding to me doing a sternal rub, which those of you guys know, that's how you get a patient to respond to you. You rub on the sternum to kind of see where their orientation is at that moment. Not responding to either. Get vital signs. Vital signs are terrible. Blood pressure's low, heart rate's low, and his respirations are trash. So at that point, I'm like, rapid response. Nothing else I can do. Those of you guys who know what a rapid response is, you know that you are about to have a flood of people run into this room, and people are about to ask you 1,000,001 questions about this patient. So as I'm trying to prepare for the rapid response team to get there to ask me a whole bunch of questions about this patient that's only been under my care for about a few hours. I'm getting ready. Of course, they come into the room. They make you feel stupid as fuck. Which, no, like, that's just how it is. Like, they just gonna make you feel stupid, like you don't know everything that's going on with this patient. But it is what it is. And in the case, and I just say, I don't know. So they feel like the patient might have had too much medication. They tried to give the patient Narcan. That didn't work. So the patient continued to decline during the rapid response. So they had to end up intubating the patient, meaning that the patient was not sustaining an adequate respiratory status for him breathing on his own. So we had to put a tube down his throat so we could help him breathe, bag him, or or maybe even potentially later put him on a ventilator. So while they were intubating him, he stopped, his heart stops. So then the rapid response turns into a cold blue situation. So of course, when his heart stops, we had to initiate CPR. We get the patient back, thankfully, and we get to the ICU. So like, you know, real Grey's Anatomy type shit. Like they're like, we get him back, we get him to the ICU really quickly. And then his daughter decides, like, no, stop. I'm gonna make him a do not resuscitate. Stop. So the patient they end up calling the time of death, not on my floor, but in the ICU. But I was still under that patient as his primary nurse. So the ICU nurse was like, well, this is technically your patient, so you need to do the death process. And I'm just like, really? Like, after I've given report, but they hadn't changed it in the computer yet. So I end up having to do the entire death process of this patient because the daughter ends up us not wanting to continue with the CPR. She ended up wanting just to make him DNR so he can pass peacefully. So on top of all that, mind you, my shift is over at this point. Like, it's like after 7 o'clock. I get off at 6:30. So I end up staying to like almost 8 o'clock, 8:30, documenting the day, documenting everything that would happen, just in case some stuff comes up later. Those of you guys who know, who ever been a part of a deposition, you know you really want to get your documentation on point. So that I don't think I end up getting back to my hotel room from that day until like almost 9 o'clock. It was after 9 o'clock probably when I got back. So that is probably the worst shift that sticks out to my mind. And those of you guys know, when you have a bad shift, it just kind of sticks out in your mind like all the time. Like, so that was my bad shift, you guys. Thank you guys for tuning in. If you made it to the end of this video, I appreciate you. Give this video a like, thumbs up. Please subscribe to my channel and follow me on Instagram if you have not already done so, at Adam Deshawn. I have more content coming soon. Thank you guys for bearing with me. You guys know that I am very sporadic with my videos because they take so much time to do, and they also take a lot of time to edit. But thank you guys. Love you.